Florence Nightingale, the pioneer of modern nursing and global health advocate. Introduction. Florence Nightingale, a name synonymous with compassion, dedication, and innovation, stands as one of the most influential figures in nursing and healthcare history. Born into privilege yet driven by a profound sense of purpose, Nightingale revolutionized the nursing profession and transformed healthcare practices through her tireless advocacy, pioneering work, and visionary leadership. This video delves into the life, influences, contributions, and global impact of Florence Nightingale, shedding light on her enduring legacy and the profound mark she left on the world. Who was Florence Nightingale? Florence Nightingale, born on May 12, 1820, in Florence, Italy, was the second daughter of William Edward Nightingale and Frances Nightingale. Despite being born into a wealthy and privileged British family, Florence rejected the societal expectations imposed on Victorian women of her time, who were expected to marry and adhere to traditional domestic roles. Instead, she felt a calling to serve humanity and pursue a career in nursing, a decision that would shape the course of her life and profoundly impact the field of healthcare. Childhood and early influences. Florence Nightingale's upbringing played a crucial role in shaping her worldview and instilling in her a sense of duty towards others. Raised in a well-educated and intellectually stimulating environment, Florence received a rigorous education in mathematics, literature, and the sciences, uncommon for women of her era. Her parents encouraged her intellectual pursuits and provided her with access to a vast library, nurturing her intellectual curiosity and thirst for knowledge from an early age. Florence's upbringing also exposed her to the plight of the less fortunate and the suffering of the sick and marginalized. Influenced by her family's philanthropic activities and her own experiences volunteering in hospitals and charitable institutions, Florence developed a deep compassion for the sick and vulnerable, igniting her passion for nursing and healthcare reform. Life and contributions. Florence Nightingale's transformative journey in nursing began in earnest when she embarked on a mission to pursue her calling against societal norms and familial expectations. Despite facing opposition from her family and encountering societal barriers, Florence remained undeterred in her determination to pursue her vocation. In 1854, amidst the Crimean War, Florence Nightingale was appointed as the superintendent of nurses at the British military hospital in Scutari, now Üsküdar, Turkey. The conditions at the hospital were deplorable, with unsanitary conditions, inadequate medical supplies, and high mortality rates among wounded soldiers due to preventable infections and diseases. Recognizing the urgent need for reform, Florence implemented revolutionary measures to improve sanitation, hygiene, and patient care practices. Florence Nightingale's pioneering efforts in nursing and healthcare reform revolutionized the standards of care and laid the foundation for modern nursing practices. Her meticulous record-keeping, statistical analysis, and emphasis on evidence-based practices established her as a trailblazer in healthcare management and epidemiology. Through her advocacy and tireless work, Florence transformed nursing from a menial task performed by untrained volunteers into a respected profession characterized by skill, knowledge, and compassion. Significance to nursing and history. Florence Nightingale's significance to nursing and history cannot be overstated. She is often hailed as the founder of modern nursing and revered as a pioneer in healthcare reform. Nightingale's contributions revolutionized nursing education, professional standards, and patient care practices, setting a new benchmark for excellence in healthcare delivery. Her seminal work, Notes on Nursing, What It Is, and What It Is Not, published in 1859, remains a cornerstone of nursing literature and continues to influence nursing practice and education to this day. In this groundbreaking treatise, Nightingale emphasized the importance of environmental factors, hygiene, and holistic care in promoting health and healing, laying the groundwork for modern nursing theory and practice. Moreover, Florence Nightingale's advocacy for healthcare reform and her commitment to social justice paved the way for advancements in public health, sanitation, and healthcare policy. Her influence extended beyond the confines of the nursing profession, shaping broader societal attitudes towards healthcare, philanthropy, and the role of women in public life. Influence and global impact. Florence Nightingale's influence and global impact transcended national boundaries and continue to resonate across continents and cultures. Her work during the Crimean War and subsequent efforts to improve healthcare practices garnered international acclaim, earning her the nickname, "The Lady with the Lamp," and inspiring generations of nurses and healthcare professionals worldwide. Nightingale's advocacy for sanitary reforms and her emphasis on preventive medicine contributed to significant reductions in mortality rates and improved public health outcomes. Her advocacy for healthcare reform and her emphasis on evidence-based practices laid the foundation for modern healthcare systems and public health initiatives, shaping the trajectory of global health for centuries to come. Furthermore, Nightingale's establishment of the Nightingale Training School for Nurses at St. Thomas' Hospital in London in 1860 marked a milestone in nursing education and professionalization. The school served as a model for nursing education worldwide and contributed to the professionalization and standardization of nursing practice across different cultures and contexts. Conclusion. In conclusion, Florence Nightingale's legacy as a pioneer of modern nursing and healthcare reform remains indelibly etched in history. Her unwavering dedication, visionary leadership, and compassionate care transformed the landscape of healthcare, elevating nursing to a respected profession and reshaping societal attitudes towards health and healing. As we commemorate her life and contributions, let us honor Florence Nightingale's enduring legacy by continuing to uphold the values of compassion, excellence, and innovation in nursing and healthcare. Remember to hit the like button and subscribe for more factastic videos.